Okay, here we are. We're going to do another video training just to kind of introduce everybody to the new Scott APR 742s and how they attach to our face pieces. But a couple important points that I'd like to make about the face piece before I move on. Because we are not going to be connected to air, we don't have that positive pressure feeding into the mask, so we need to make sure that we create a really good seal. And we got to make sure we inspect our masks in order to create that seal. So the first thing that we want to look at is we want to make sure that our nose piece is seated properly in around the grooves on the exhalation valves. The second most important part is to make sure that our nose piece comes out over top of the face seal like such. Once your mask is like that, it's ready to have the APRs attached to it. The APRs are situated in our COVID kits or our MRT kits, and they're going to be just in a sealed plastic bag like this, and you can open them as needed. They're unassembled, and you can assemble them onto your face piece before you actually don that face piece. Inside this kit, you're going to have two N95 cartridges already pre-assembled, and then we've got the adapter. So this is what the adapter would look like, and here's what the cartridges look like. So from there, it's the same as attaching our regulator. It just seats in, and we do a quarter turn till we hear it click, and it locks in exactly the same as our regulators do in our face piece. Now from there, to get the cartridges on, the cartridge on the right side of the mask starts down. You just got to seat it, then it rotates a quarter turn into place. The cartridge on the left side of the mask starts up. Once you get it seated, you rotate it into place. Our mask is ready to be put on now, but we want to remember that we always follow the appropriate donning procedures. So I'm going to ensure that I get my booties on. I'm going to put my gown on. Nothing changes in this aspect of our PPE. I just wanted to make sure that I go through it so that I'm emphasizing that nothing changes. It's just the addition of the face piece. Once we get our gown on, quick little knot on the back, and then I'm going to put on my gloves. Like I said to you guys before, I like to double glove, so we should start doing that for any of the calls that we get called out to. Making sure that I get my glove up over top of the cuff of the gown, making sure I put my thumbs in the thumb holes. Again, making sure that glove goes up over top of my cuff. And then I'll set my second pair of gloves on. It is a time-consuming process. We need to slow down a little bit when we're preparing for one of these medical responses, ensure that we've got everything donned properly. Got my gloves on. Now I'm ready to put on my face mask with the adapter. It's exactly like we would going on air. Face piece in. Strap over top the back of my head. I always want to make sure that I get it seated onto my face and I hold it where I want it. Make sure I got no twists in my straps. And then start on my chin strap first, pulling tight one side. Bring my hand around to hold back onto my face mask. Pull it again. Then I move up to the tire strap. And last but not least, the top strap. I want that seated on my head like that. We noticed that a little cap fell off. That's okay, we can just pick that back up. push that back on. It's just a little safety cap to keep our one-way valve from blowing open too far. Once that's on, I want to ensure I get my hairnet in place. Once it's in place, the last step that I'm going to do when I'm donned like this is I got to do my seal check. So I'm going to put my hand over top of both of these holes, or both hands over the holes, and then breathe in. The mask sucks straight to my face. That's the most important step. Breathing in. And then doing a quick exhale to make sure that that valve on the front works. And that's what we've done. Now we've donned with our face mask. One thing that would benefit from me now is if I could get Kevin to step around here and he's just going to do a final check to make sure that I've got everything covered that I need to have covered.
Here, this got caught on your...
Perfect.
So, you might want to just say that piece of metal at the top has a tendency to rip.
Okay, did it. So then, if something like that happens, then we can just grab another hair protector and then just move forward like that. Now we're totally, completely donned. So now, when we come back outside, you can cut and put her where you need to, whatever.